Thank you, Madam Chair. First, I want to apologize to anyone who was offended if they saw me wearing a mask in recent weeks when our building was filled with more than our normal number of people. I, along with some of my colleagues, I am immunocompromised, so I am in a closed setting with a lot of people who may not be vaccinated or who may be immunocompromised. I do wear a mask to protect myself and to protect people in the community. It was not meant as an insult or to say, that somebody is nasty or dirty. It was simply to protect my own health. Moving on, I actually do have a degree in public health. I've spent the last 30 years reading and analyzing scientific research, develop policies and programs to protect the health and safety of the American people on the local, state, and federal levels. None of that work was to gain power or control over people's lives. We need to look back at the beginning of the vaccine hesitancy to understand why we're here today. Don't worry, I'm not going to go into a long history of public health. That would take us all the way back to the 17th century and mandated quarantines for things like the plague, which, by the way, did work to help stop the spread of the plague in certain places. But we need to only go back to the 90s. And that's when Andrew Wakefield, who is a disgraced snake oil salesman, published a completely fraudulent, bogus scientific article linking the MMR vaccine to autism. Not only was that study completely debunked, further investigation found that Wakefield had actually planned to capitalize on the MMR scare that he caused to sell test kits for what he called an MMR vaccine-related autism enterocolitis, which is a disease that does not exist. He himself, during this investigation, said that he stood to earn up to $43 million from this vaccine scare that he caused with fake data and a fake study. That grifter set in motion the greatest distrust of the U.S. government since Watergate. And all of that was based on his own desire for $43 million.
Keitt, if I may interrupt you, again, just in terms of speaking, if we cannot cast aspersions as we speak, just stick with the facts of
I apologize. Those characteristics of him being a grifter was by medical professionals in journals in Great Britain who have since decertified him as a researcher and scientist. I apologize.
Thank you.
But the disease does not exist, I will say that. I was living in Virginia when this study came out. I had 2 young toddlers, and I saw a lot of terrified parents rushing to get religious exemptions because, yes, doctors would not give them medical exemptions because there was no medical reason for their kids not to be vaccinated. And if somebody's religion, if their religion, their religious doctrine says you shall not get a vaccine, that is very different than saying, I personally don't want to get a vaccine. And I'm not going to tell you what to believe from your religion. But basing vaccine policy on personal held beliefs, no matter how strongly you believe in them, I have a problem with that. I have a 21-year-old daughter who believes it's perfectly safe for her to drive 95 down the Merritt at any time of the day. It's perfectly safe. She won't hurt anybody. I personally have put a boot on her car so she can't drive. And I would hope people around this circle would agree 95 on the Merritt is not safe. But she has a strongly held personal belief that she should be allowed to drive that fast. We need these bills today because they are a check. They are our state's check on this administration's attack on science and medicine. That is why we need them. All we are doing is preserving our state's right to provide affordable, scientifically proven vaccines to the people who need them. This administration just feeds the distrust and fear of science And we need to counteract that. We are that backstop for the people who rely on our public health system to stay safe and to stay healthy. To speak on the fact that, our constituents haven't been heard. I have read hundreds, if not thousands, of emails, including all the written testimony that was submitted. Maybe some of my colleagues haven't done that. I encourage them to do so. I don't agree with a lot of what was submitted, and that's, because my background is different. I come from a public health background, a science background. You show me science doesn't work, you show me the science that these are dangerous, that these vaccines don't work. There is no science. Are they 100% safe? No, nothing is 100% safe. But we have decades and thousands of studies that have shown that the benefits of vaccines far outweigh the risks. I hear my colleagues are concerned about mandates, either the current ones or more down the line. I can't say if there'll be more mandates down the line. We don't know what's going to happen. COVID showed us we cannot be complacent in our public health infrastructure and policies and programs. We have to be able to remain vigilant and agile so we can address them as they come, and that's what this bill is going to do. We may be able to drop vaccines from the schedule if we can do our due diligence in making sure everyone gets vaccinated. We don't have smallpox in the wild anymore. That is because of vaccine policy. We almost eradicated measles, almost. We were so close. Now we have over, 10,000 cases in South Carolina, or it's even higher than that, going right now. And measles is not a simple childhood disease. It can lead to blindness, neurological deficits, encephalitis, sterility, death. These are not simple childhood ailments. Science. I kind of want to go back to something else I've heard today. I signed up for a job to listen to my constituents, but also to use my own judgment, to do what's in the best interest of the people of my district and of the state. If the majority of my constituents came to me and said, I think it's a bad idea to take PFAS out of our water, should I vote then to keep PFAS in our water? Or should I act on the scientific evidence that says PFAS and forever chemicals are bad? Sometimes we need to use our own judgment. That does not mean I do not respect my constituents. It means I am using the whole body of evidence that's available to me that may not be available to them. It means that I have read the legislation thoroughly and I understand what it's about. And I'm using my best judgment when voting. It's not a simple party line. It's that I am using my own personal training, my education, my background, input from professionals, and input from constituents. Science, true science, is apolitical. And I am sorry for everyone here who has had to testify and had to come here because we have politicized one of our greatest public health advances in modern history, vaccines. We had fraudsters create a vaccine scare. We've had other people capitalize on that. We need common sense, and common sense that this bill will help us navigate science and healthcare and public health as it evolves, because that's what science does. It evolves. So I am wholeheartedly voting for this bill to make sure that we can continue to provide vaccines to anyone who wants them, especially those who rely on the public health system and our public health departments to provide free and low-cost vaccines. Thank you, Madam Chair. That's what I needed to get off my chest.